Namaskar and welcome to Apollo 24/7's Health Hour with experts from Apollo Hospitals. This is going to be a live session where you can interact with Apollo's experts. Joining us very shortly is Dr. Srishti Patoria, Senior Consultant Internal Medicine from Apollo Hospitals, Greens Road, Chennai. And आज आप उनसे बात कर सकते हैं. You can chat, you can type your questions. I'm going to take the questions up for you in the chat box of YouTube only. You must be watching this on Instagram and Facebook and YouTube. But if you want your query to be answered, hop on to the YouTube chat, type your question there. We shall place it before the expert. Today we're going to talk about Diwali Safety Guide, managing breathing difficulties, diabetes and burn mishaps, everything about how to keep yourself safe. तो चलिए शुरू करते हैं. Before that, I would want you to download Apollo 24/7 app because this one app brings you entire facility of Apollo hospitals, right from your labs to hospital services like consulting your experts or even buying medicines. Everything is easy when you do it from Apollo 24/7, and of course there are a lot of benefits when you download 24/7. Today I'm going to give you gift vouchers and discount vouchers as well, which you can use in Apollo 24/7. तो चलिए आज हमारे एक्सपर्ट से बात करते हैं और पता करते हैं दिवाली पे हम सेफ कैसे रहे और कैसे हमारे एग्जिस्टिंग इश्यूज को मैनेज कर पाएंगे. Let's meet Dr. Srishti Patoria, who's a senior consultant internal medicine, Apollo Hospitals, Greens Road, Chennai, with more than 10 years of experience. Dr. Srishti can be consulted for general and internal medicine issues, critical care, and palliative medicine. She has memberships in the European Society of Intensive Care Medicine, Indian Society of Critical Care Medicine, Neurocritical Care Society of India, Care Society, Indian Association of Palliative Care, and the Association of Physicians of India. Let's welcome Dr. Srishti Patodia. Good morning, ma'am. Welcome to the show.
Namaste, good morning. And I'm really excited to be here. I'm so happy that I'm talking about my favorite festival of the year. And
That's
yes,
good
a
one.
very important,
Yes, the
very important area that we are covering.
Absolutely, ma'am. As you've rightly said, this is Festival of Lights and सबसे प्यारा festival भी है, and such a big festival in the north. And Deepavali for south also is a very big festival. So it's important
Very
for us
much,
to
very much.
talk about the festivities as much as we have to take care of our health as well. So, while being cautious, while we enjoy your festival, let's take at least certain elements of consideration before we start our festivities. तो शुरू कर दे मैम.
Yes, already.
Done. So, as I talk about Diwali, all that I can think of right now is all Diwali parties or all the gifts that I'm getting, which include every gift that I'm getting at home includes mithai, burfis, and lot of what do you call dry fruits. यही मिलते हैं. तो दिवाली इज इक्वल टू खाना बन गया. दिवाली यूज्ड टू बी फेस्टिवल ऑफ लाइट्स अर्लियर. आजकल तो दिवाली इज इक्वल टू फूड बन गया. So, where are we heading it at?
So I completely agree with you. And usually, even if you get a Diwali hamper, ऊपर से there may be crackers or there may be diyas, and then you go dig deep, 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 and there's always that mithai ka dabba that comes out. So one of the things that I'm really happy myself to note is I feel that even the general public have changed their mindset. People are sharing more dry fruits and less of the excessively indulgent sweets. But that said, हमारे घर पे ही काफी दिवाली की मिठाइयाँ बन जाती है. And between showing love by pampering with food, which is the probably the only way India knows to show love, and and the
There's
sweets
nothing
that
wrong.
we receive, not at
Yes.
all. I love
Yes.
receiving the sweets too.
It's up to
But
us how we consume them and how we burn them. There's nothing wrong. But then
exactly,
भी खिलाते हैं या pre-existing issues होते हैं, that's when one has to be extra cautious, no ma'am. So let's talk
cautious,
about the
yes.
vulnerable group. The first and foremost pre-existing vulnerable group is diabetes. So what is the word of caution from your end?
So one of the things that I always believe in is we should not deprive ourselves just because one has diabetes. In fact, when I Every time I have a patient who's newly detected diabetic, they get very upset, and I tell them, it's like brushing your teeth. If you were not to brush your teeth every morning, your teeth would decay. And it's the same thing with diabetes. You take your medicines regularly, you look after your general health, and you're going to be fine. Now, when it comes to Diwali, usually I am not a big believer in, stay away from the sweets, have only sugar-free sweets or any of that. Because what usually happens is the comeback from excessive deprivation is excessive binging. So
Right.
this year you may have deprived yourself, you'll follow it up with a binge next year or 6 months later. I would say choose
You know
one
that.
sweet a day.
I know that very well. I've been doing that, so I understand that. Yeah.
So I would say have one sweet a day. Choose a sweet that morning. It could be something you received in a hamper. It could be something you bought off a shelf. It could be something that's made at home. Make sure the sweet doesn't come out of a can. Okay, stay away from everything that is overprocessed, something that says its shelf life is 3 months, 6 months, because then it has a lot of other fats, which is not your traditional ghee alone. Many a times, these pure ghee sweets that apparently can be preserved for 6 months are just flavored with ghee, but they actually don't have that much of healthy fat in them. And so stick to one sweet, choose your sweet. It could be your bundi ka laddu, it could be a Mysore pa down south, or it could be a khaja, and split it over the day. So say have half the sweet post lunch, half the sweet post dinner. Savor it, relish it, enjoy it. Don't watch TV while you're having that sweet so that you actually
Oh,
internalize the flavor, enjoy it thoroughly. And then
yes.
you the next morning you move on to your next sweet. So say 5 days of Diwali, you've actually had five sweets, one a day. You've not gone overboard. You know that you've indulged yourself, and
Well,
at the
here,
same time, it will not take you completely off on your blood sugar levels either. That
I've never
said,
seen a doctor who's
um,
this sweet, Dr. Srishti. Let me give you a compliment on the onset. So,
thank you.
here's a registered user's question: is it okay if we have a little too much sweet around Diwali time, and if I am diabetic, are there any alternatives?
So
So, now, too much क्या हो
I
सकता है?
I exactly. So I agree with your point to that question. What is too much? Because I'm saying you can have one sweet a day for 5 days. So I'm allowing you to be excessive already. So I don't know what you're talking about a little too much here. But yes, if it so
But what can
happens
be
that you do
taken?
get indulgent, really, my few really strong recommendations are number one, don't skip any medicines. Don't say, I have guests at home, I don't have the time to take my insulin today. Chalta hai, it's just Diwali. Don't uh, self-medicate. Don't assume that, 6 months ago I was on insulin, then my doctor stopped the insulin for me, and I still have it lying in the fridge. I want to eat a lot of sweets for Diwali, so let me give myself a shot of insulin. No. So, no drugs without a doctor's prescription, no skipping your medicines, and your vice. If your vice is mithai, then have it, but compensate in other ways. Exercise, try and get a little bit and maybe, if you walk every day, add another 15 minutes to your walk. If you play a sport, add 15 more minutes to that sport. Try and see if you have, say, a walking or a steps tracker. Try and target 25% more steps than your usual. In addition to all that, please try and balance. So, for example, just because you eat for Diwali, then skip the samosa and the kachori or murku and the idea being that you balance it out. Have a lot of
Ma'am,
have a
your
lot of
voice is
have
breaking.
a lot of protein.
I want you to
Hmm.
repeat the answer, the whatever you've said again, because your voice was breaking quite badly. We didn't get you,
All right.
and you're frozen too. So,
All right.
the last.
Like I was saying, basically what you want to do is you want to balance your indulgence. It is perfectly fine to say that I would really want to go crazy on sweets today, but then 2 days before, 2 days after, go really healthy. Add 25% extra in terms of physical exertion, be it walking, a sport that you play, be it running, whatever it is that you do, 25% more number of steps than you usually do, and balance your meal. So if you're going to eat a lot of sweet, have a lot of vegetables in your meal, try and not be excessively indulgent in all aspects. Okay, so and please don't skip your medicines. Don't self-medicate. Don't double your dose thinking that will balance my sugar out. It will only cause more harm than good. And the
Very
most important thing I would say is hydrate. Drink lots and lots and lots of water because most of the times when we are eating a lot of heavy food, these are all salt-rich foods. Sweets also tend to make you dehydrated. The smoke, the entire atmosphere around will dehydrate you. So drink a lot of fluids. Many a times when you think you're hungry, you're actually just thirsty. So whenever you
nice.
have this basket of pakoras in front of you, drink up a glass of water, and if you still want to have it, but I'm fairly certain you'll want to have half of the original quantity.
Wonderful
And
tip,
listen to your
ma'am.
body.
Thank you.
If your
Thank you
body
so
says
much.
it's full, it's full.
I will come back to that dehydration and that half full or full concept. Rakshak is here, who's a regular viewer on our show. Hi, Rakshak, welcome to the show. Very important questions that this gentleman asks us. Is artificial sweetener, saccharin, or any other sweetener good for health? Please suggest alternatives for diabetic patients. So, what is your take on artificial sweeteners, ma'am?
So, see, ma'am, basically, hi, Mr. Rakshak, and I feel your question is very valid. It's an important question, and the thing is, the problem with artificial sweeteners is it sort of gives us an excuse to go overboard because we think that after all, this is sugar-free. But anything that's tasty is and feels indulgent is indulgent. So if they are giving you something with artificial sweeteners, they are making up for it in the fat, in the flavoring. There must be artificial flavoring and all of that. But if you were to necessarily want to choose an artificial sweetener, then maybe stevia and not any other artificial sweetener. Aspartame, sucralose, these are all fairly risky, and there are a lot of risks of cancer associated with long-term consumption. So, if you were to really want to have artificial sweeteners, then I would only recommend stevia or a smaller bite of a regular sweetened dish so that you know that you're indulging, you limit yourself, and you enjoy the taste.
Wonderful. Thank you so much for answering that. And now let me talk about the festivities and tayariya jo hote hai. We're all somehow pressurized around Diwali time. And I think, my personal observation that any festival, I tend to get dehydrated. I'm not concentrating on the kind of water
Yes,
that I generally consume. So I then when I discuss this around with my friends, I find it with them too. It's the same with them too. So dehydration and how do we tackle, especially around Diwali? There's so much of firecrackers, so much of work to be done, and there is, of course, generally we light up the entire home. There's heat again.
correct. Very true. So, and to add to that, it's fairly cold, so you don't feel like you're sweating, so you don't feel the need to drink water.
That's the reason
And
around Diwali. Correct.
so, yes, I would say that hydration has to be top of your list. 8 to 11 glasses of water a day, or if you're going to measure it by the bottle, a liter. Keep a bottle which is about a liter and have 3 liters a day. Now, this doesn't have to necessarily be water. It could be tender coconut water, it could be buttermilk, it could be anything, but at least 3 liters of liquids a day. Please try and, drink a glass of water 10 minutes before you eat something. There are many people who believe that you should not drink water with a meal, which is fine, but try and have a glass of water about 10 to 15 minutes before you sit to have anything. That way, what will happen is that your stomach will already be half full. So it will also help you to be careful with what you eat. At the same time, every time you're going to put something in your mouth, if you're going to have water, it's the easiest way to remember that you need water. The other thing I would recommend is to remember to drink a glass of water every time you come out of the restroom. The idea
Okay.
being you wake up, have a glass of water, one glass of water before you sleep, one glass of water every time you use the restroom, and one glass of water 10 to 15 minutes before anything you eat.
Indeed.
It should largely cover 8 glasses to 11 glasses a day.
Wonderful way to
But
keep a tab on your water consumption. I think I will. This is the first time that I'm listening to this advice of coming out of your restroom. You have a glass of water. Makes sense actually. So I will
yes, you
start.
just let some water out.
Yes, and I will give you the feedback as well. Just in case, my dear viewers, if you want any more diabetic help, consultations, or management, Dr. Srishti is available on Apollo 24/7 as well. We've left her link to consult her on in the chat box as well, so you can go ahead and consult for further. Because today's episode we're going to talk a lot about Diwali, not just diabetes. So I'm moving on from diabetes. If something else that you would want to know, please do consult her on her Apollo 24/7 link. So, Dr. Srishti, next question that I would want to understand is about the next vulnerable group who have issues with their breathing. Could be asthma, could be pulmonary issues. So, Diwali is the time around when North India is grappled with pollution and per se Diwali week due to the crackers in South India. So, how do the second vulnerable group of breathing issues take care of themselves?
So, this is a very difficult and trying time, especially in the north of India, especially in a place like Delhi, where pollution is already, I don't know, hazardous is like a way of life now there.
Mumbai as
But
well. We are hearing stories from Mumbai.
yes, very scary ones. Yes, indeed. So first and foremost, for anybody who has any kind of a lung disorder, be it asthma, pulmonary fibrosis, COPD, patients who tend to otherwise not wheeze but develop wheezing, especially in this season, always keep your inhaler by your side. Don't skip any of your regular inhaler doses or your medications. And my usual recommendation is, especially in places like Delhi where the smog is very bad, try not to go out either at dusk or at dawn. Keep your windows closed, especially if there are a lot of firecrackers being lit in your, area surrounding your building. And in order to help those who, are suffering around you, please try and go for pollution-free firecrackers, even if you really want to light them. If you're an asthmatic or somebody with breathing trouble and you really want to go out, or say you need to go out into an open area where there are firecrackers, try and use an N95 mask, because these masks also tend to filter a fair amount of the dust and pollution. You can try using air purifiers at home, but they make sure that the air purifier is kept in an area which is, the exact square feet area that the air purifier is supposed to
Capacity.
clean. Yeah, because many a times what people do is, you keep an air purifier in a large hall or in a house which has an open or a high ceiling, and then it really doesn't do its job. So make sure you're ideally keep an air purifier inside a room so that somebody who is having breathing difficulties can stay in there. Always
I
make
can add
sure
some,
that
can I add
if
something
you,
here, ma'am? Yeah, because
yes,
my father was a COPD all his life for a very long time till
hmm,
he breathed his last. So I had to manage his bedroom or the place that he sat with three air purifiers because the rooms were big. So having
right,
one wasn't enough. So I had to,
enough,
have one, two in the room and one by his bedside. So that's how I managed his quality air in the room.
correct. So then that's exactly what I was also trying to convey, which is, make sure that you don't, because if something is working beyond its capacity, it will not really be doing its job well.
Correct.
Uh, in the eventuality that you do have any persistent cough, breathing difficulty, discomfort, or your wheezing seems to worsen, please go to the nearest healthcare center. I know that there is a lot of traditional belief that the doctors are not really available during Diwali, or your senior doctors are not available. But I feel that in that aspect, healthcare has really evolved in India, and we all, at least some, all of us work in turns. We make sure that we're all available for our patients because at the end of the day, if you get treated early, you can prevent suffering a lot. Please
Absolutely.
don't have a mind block that saying, Diwali pe hospital nahi jana hai. It's not like that. Sometimes it will not really require admission. All you need is a nebulizer, somebody to check you up, give you a shot of something, and then you should be fine, ready to go back home and enjoy the festivities with your family. That
Yes,
said,
here I
one
think,
additional tip,
yes, please go on with your tip, then I'll add whatever I wanted to say.
thank you. One additional tip for anybody with breathing difficulty is please try not to overeat. One of the common mistakes that people do is they think that the lung and the stomach are two different entities and they're not really connected. But unfortunately, we're all whole in one body. And when you do tend to eat a lot, you will have bloating, you could have reflux, and that could precipitate cough and discomfort. So eat light, stay hydrated, and don't skip your inhalers.
Great tip, ma'am. I think we should dig in more about that overeating and indulgence in a bit. So, I wanted to tell my viewers that Dr. Srishti Patodia was awarded for her services during the COVID pandemic time by Apollo Hospitals. She was recognized. So, जब हमारा पूरा सिस्टम परेशान था कि क्या करें, Dr. Srishti and her team were relentlessly serving people, and Diwali is just one day, and a lot of experts from Apollo hospitals are taking turns to be on Apollo 24/7 to be available. Thank you so much for being
Thank you.
there, and we recognize your efforts and services, ma'am. Thank you once again. So
Thank you so
yes,
much.
Apollo 24/7 that way has made it so simple and easy, I must say, Dr. Srishti. Do you also meet
Very
patients,
much.
your consults online?
Yes, and it really helps because sometimes, for example, somebody travels from another state, and I would see them the first time in person in the OP. And obviously, for every review, they cannot travel and come down. And by getting them on the Apollo 24/7, it's easier to review, it's easier to stay connected because it's a visual call. I can see them getting better. So there's a lot of positive feedback even for us. And it is so much easier to maintain that interpersonal relationship and that way, even patients who've had long hospital stays, who've been very unwell and then they recover, we don't need to ask them to come back for even up to 6 months to a year. We, manage just by the 24/7 calls and we get to send prescriptions. It helps. I'm sure that, uh, and then, you have this the chat system, which allows them to stay connected with us. So even if, say, I ask for an investigation, they will do it the next day and send it on the chat window to me. So I'm able to reconnect then and there. I know, I don't have to wait for when they'll consult again next. So it's very useful.
Wonderful, ma'am. Thank you so much for giving that input from your end, because it's easy for the patient who's consulting, and also as the doctor, treating doctor, I think it's easier for you
Yeah,
also to keep a tab on
definitely.
the prognosis. Well, here's the next question. Registered user asking, should we practice breathing exercises at home so that around Diwali our lungs are a little better?
Um, so I would say you should practice breathing exercises at home irrespective of Diwali.
Ah, yes.
But the thing with any form of exercise is it takes time to show its effect, and it takes half the time for the effect to wear off. So if you were to try, say, starting breathing exercises from today, then I will just say, great, let Diwali be the reason that you start. But I wouldn't expect it to show you results for this Diwali as much as it would if you were consistent about it all year. Then by next Diwali you will be a different person. So
I'm a fan
because
of you.
you're,
Become a fan of.
thank
Yes,
you.
very sad. Very, very sad.
So
So,
yes,
तो शुरू कीजिए,
please do
दिवाली के नाम
breathing.
पे शुरू कीजिए.
बिल्कुल.
Yes. Correct. And the continuation, the next user is asking this question: how to breathe easy and better around the Diwali pollution?
So, like I said, one of the ways is if you have a breathing problem, then you stick to wearing an N95 every time you're stepping out of your house. Avoid keeping your windows open, especially at dawn and dusk when you know the smog is heaviest. Try and keep a couple of rooms in your house always with windows closed so that you have a clean zone. Ideally, I would say again, a lot of green plants around the house, but too late for that decision now, 4 days before. Um,
Correct.
but if you are somebody who's a little wary, I mean, say you don't really have breathing trouble, but you get uncomfortable with all the pollution, a regular three-ply mask whenever you step out should help. Keeping hydrated and ensuring that you don't directly come in contact with firecrackers when they're being lit will really go a long way in helping you. Pollution is more a community thing. So, encourage your community to go either firecracker free or to use pollution free firecrackers. And besides that, I really can't, um, you know, I wish I could do something about the pollution and smog, but the only thing we can really do is, yeah, wear a mask and stay safe.
Yes. Here's the next question from a pregnant woman. I don't have the age and other issues, complications. How to be cautious during this time for pregnant women in terms of diet, breathing, etc., and of course sweets. And are there any recorded issues with pollution and then fetal development, etc.?
So let me first answer the last part straight away. No, there are no, I mean, if you were worried about what is in the atmosphere with fetal development, it's nothing in India that would bother you. It's radiation exposure that causes trouble, which fortunately we don't deal with. So with regards to pollution and fetal development, no, not really a challenge. With sweets, again, if you're not a diabetic, then go ahead. I would still say have one sweet a meal. Avoid anything over processed. Avoid things that that come out of a tin or a can. Stick to fresh stuff made at home. Stay active. And one of the most important things with pregnancy would be that eating heavy can cause severe indigestion, worsen your vomiting and nausea. So please go very careful on that. Uh, Try and stick to cotton clothes. Avoid excessive synthetic clothes because one, that itself is a fire hazard, especially when you're trying to, even if you're just lighting a lamp. And the second is that you would want to ensure that you get enough rest. Don't overexert yourself. Listen to your body. If you're more than 5 months pregnant, you're able to feel your baby move, keep conscious, stay aware of your baby movements because sometimes that's the first sign of dehydration.
Okay.
Besides this, just be really careful with your walks. Be careful with wearing footwear that has good grip. The footwear should not be either excessively high heeled because that can also hurt your back, especially in pregnancy. Avoid footwear that doesn't fit you well or that doesn't have a good floor grip. And avoid clothes which can cause, which are long, flowy, touching the ground that can also affect stability and steadiness.
Wonderful tips, ma'am. I think the dehydration tip was something new that I've heard for pregnant women around Diwali. Great tip there. Thank you so much. And next question is again a registered user. Can this pollution have a serious health issue if we are we not safe? What are the repercussions of the pollution that we're facing?
So, unfortunately, I wish I could say there are no repercussions, but there are, especially, when you're talking about any pollution level where the levels are more than 300. You are there, we are all at a risk of becoming having COPD in the long run because basically we are breathing bad air, challenging our lungs, causing a sort of exertional breathlessness for ourselves all the time. So, yes, being exposed to this level of pollution is certainly a health hazard, and it it is going to have long-term impact on us, especially, for the next generation, because they are sort of born into this pollution. They will be living with this. So, over a period of time, there will be some lung scarring that will happen as a consequence of this.
Oh, that is really scary, but we all have to do
It
something
is
collectively, policy wise, and then
correct.
community wise. We need to do something. This is the time that we all do something for the change that we want to see. And I
Yeah.
hope the day is very soon. All right,
You
next
know, if
question. I
if
would want to get,
I may
yes, ma'am.
interrupt you, if we're all so worried about pollution, then for this Diwali, let's all plant a tree. And if all of us do that, then maybe we will have a much greener country, and we would have truly given a gift to the next generation.
Wonderful, ma'am. I'm taking yet again a wonderful tip from you. I'm going to plant 10 this year in the farm, and let me see if I can start a
Great.
chain of people celebrating Diwali with plants. Thank you so much for that. Well, let me come back to that indigestion and overeating indulgent Diwali celebration. You were talking about, indulgent eating, and then your gut being reactive to that, and then thereby getting other issues from lung. What's the connection between them? Can we explore a bit more?
So essentially, what happens is, ma'am, see, basically, every time you overeat, you have bloating, okay? And when you have bloating, you are not giving your lung enough room to expand comfortably, number one. Number two, you could have reflux. You will tend to keep burping, which is a sign of reflux. And that in fact, we see a lot of patients who complain of persistent cough, and they would have taken cough syrup after cough syrup and gone through so many tests and treatments only to realize that actually all they had was reflux. So it's basically the acid in your stomach getting pushed back through your food pipe, coming to the base of your base of your throat. And this is acid, right? So it stings at the base of your throat. It causes a burn, and then it makes you keep coughing. So a lot of persistent reflux can itself trigger asthma. We see this very commonly in our patients. And that's the logic behind saying, eat a limited amount, prevent yourself from becoming excessively full. Don't eat food that you know causes indigestion, because even that can trigger asthma in patients who are susceptible.
Ah, that's an interesting observation, and thank you so much, ma'am. Next question is about allergies. A registered user, I don't have the gender and the name here. What about respiratory diseases? Oh, no, that not allergies, allergies, yes. How to deal with the allergies in this season? What to do if they get excessive?
So, if you were talking about allergies to the firecracker dust, then the only thing really would be if it's skin allergy to wear, long sleeve clothes, covered, make sure your feet are covered, wear a pair of socks, wear a mask all the time. But if the allergy is inhaled, which is, you're kind of like a wheezer who develops wheezing only during pollution, then it goes back to the same precautions we follow for asthma, which is you wear an N95 mask, avoid getting exposed to, firecrackers and the dust that sort of emanates. The one thing that you can do with allergies is if you find that you have recurrent allergies every year in this season, then you should probably meet an allergy specialist to understand, because sometimes a lot of pollen gets released from the plants and trees in this season. And maybe that's what you're allergic to, in which case you need to meet somebody to make sure that you're on medications for these allergies well in advance, so your allergy is under control when you enter the season and you don't actually suffer as much.
Wonderful advice there, ma'am. Yes, you need to take care of your allergies. If you're known if you have a known history of allergies, please go ahead and manage your allergies. Apollo 24/7 also has an allergy panel test if you would want to get one done on the recommendation of a physician only. Well, next question is about the eyes and the throat itching in the season. So, registered user, what to do about the itching of the eyes, burning of the eyes, and itching of the throat?
So, with regards to burning of the eyes, just ensure, always make sure your basics are covered. Make sure you're getting adequate sleep. Avoid rubbing your eyes excessively. Many a times when our eyes are red or itching, we tend to keep rubbing it, thinking it will make it better. But what it does is it actually, every time you rub your eye, you're actually causing an injury, a small injury. And then when that injury is healing, it's causing more irritation, and then you rub your eye a little bit more. So please avoid that. You can always splash cold water. And by cold, I don't mean ice cold, I just mean water that comes out of your tap onto your eye and dab it with a cool towel. Besides that, I wouldn't recommend anything else. If you have a lot of itching in your eye, then you might need some eye drops, which because itching is usually something that happens when you have dryness of your eyes. So you may need
Yeah.
eye drops recommended by an ophthalmologist. If there is, in case, some sort of a foreign body that you think has entered, dust has entered, or during a firecracker you feel that, a little bit of a piece of that barood has entered your eye, then all you have to do is splash a lot of cold water. Keep blinking as you splash cold water into your eye. Do it about 7 to 8 times. And if it doesn't feel better, or if your eyes are persistently watering, then you definitely need to go to a healthcare specialist.
Yes, ma'am.
With
That's a
regards
very
to the
important.
throat,
Yeah, yeah. Because eyes,
with regards
we
to
do
your
light
throat, yeah,
a
tell me,
lot,
sorry.
and then barood, gunpowder, or anything can get into the eye, and immediate
Correct.
attention is necessary. Yes. And with regards to the throat, you were continuing.
So, if the throat is uncomfortable, like I said, could be one of many reasons. We often neglect that it could be reflux, so you want to be careful about that. The second is it could just be because of the really bad smog and pollution. Wearing a mask should really go a long way in helping you with that. Dehydration can cause a dry, itchy throat, so hydrate yourself. If it is persistent, you can try warm water with salt, mouth rinses, and gargles. And if the throat itching is persistent, then that in itself could be an early, infection, sinusitis that's happening, or it could be a bad case of throat infection, which case you really need to see a doctor.
Yes, ma'am. ड्राई आइज के बारे में क्वेश्चन है मेरे सामने. Why do we have dry eyes in this season? Should we use the lubricant eye drops every season?
So, anytime when you're surrounded by low humidity, chill air, or a lot of pollution, it is natural to get dry eye. It's sort of kind of like a protective response that our body has. Yes, lubricant eye drops would really help, provided they've been prescribed to you. So if you've been prescribed a lubricant eye drop and you've used it through a season and it really helps, yes, you can definitely use it every season. But please ensure that it is something that has been prescribed and not something that you bought over the counter. One of the things with dry and itchy eyes is it could always be a very early sign of even a viral conjunctivitis. It could happen because you're, developing eye power, you need spectacles. So all of these are important. So if it's a frequent occurrence, please make sure you see an ophthalmologist. But lubricant eye drops in during the season could really help.
Wonderful, ma'am. Thank you. So now let's come into the major session of Diwali's questions, which is about first aid, the burns, high chances of burns, and how do we understand our safety from the viewpoint of burning crackers or diyas all around. What's the word of caution that you would want to advise?
So first and most important, during Diwali, sanitizers are not your best friends. Okay. Fortunately, the pandemic is behind us, and soap and water will go a long way in keeping you safe versus sanitizers. Please do not sanitize your hands before you touch anything that is associated with fire. So, no lamps, diyas, firecrackers. Never, because sanitizer is basically an alcohol rub, and that itself can catch fire. So first, my biggest word of caution is that. The second, please treat every firecracker as an explosive. I'm not trying to scare you all, but I'm just saying, please make sure you
Wonderful.
follow the safety precautions, even if it is, a twinkling star in your hand, a sparkler, or if it's, I don't know, a
Just a
$10,000.
candle.
But
Yeah. Anything as
always,
simple.
always be careful. In fact, even you get these firecracker matchsticks. Even they can actually technically burst. It all depends on how well the gunpowder is packed. The second thing is, if say you're trying to light a firecracker, a flower pot, or a chakram, and if it is not lighting at the first attempt, please don't try and go and relight it or pick it up in your hand and then try and light it. Trust me, um, it's not a nice feeling when these things go off in your hand. So please don't try and relight a cracker that has lit halfway and stopped, or that is refusing to light on its own. Most likely the packing of the gunpowder is not appropriate there, or moisture has entered. The best thing is to just douse it in a bucket of water and discard it. Third,
Yes, bucket of
people
water.
do have a
Very
tendency to try
importantly, have a bucket of water by your side, whatever little firecrackers you're
always.
bursting. Yes.
And whenever you're bursting firecrackers, have a clean, safe area where you're going to discard the used, be it a sparkler, be it, the twinkling star, the remnants of the torch, all of these. Don't throw them around here and there. People walking, children running around. Not everybody wears footwear sometimes. They can really get a burn if it hits their feet. The fourth
Yeah.
thing, if you are lighting some fairly heavy stuff like you'll see firecrackers, always keep a sack of sand next to you, because you may not be able to douse fire in a carton with just water, in which case you just pour sand over it and it will help to douse out a fire.
Wonderful.
If you
So here's the
do
question,
and
ma'am. Sorry, ma'am.
Mhm.
Would you want to continue,
No,
please?
no, go ahead. Go ahead. Go ahead.
Yeah. The question is about what is the first thing that we do after a burn?
Yeah. So if you have a burn, the first thing that you do is, for example, if it's a burn over clothes, change your clothes immediately. Please don't continue wearing the clothes that have, singed or burned. Second, pour cool running water, not cold, no ice, no hot water, nothing, just cool running water over the burnt area. Please do not use any of these traditional home remedies like coconut oil, butter, cream, maida, atta, besan, none of that over a burn. Don't use toothpaste, don't use talcum powder. The reason being, when there is a burn, the area needs to cool. And all our traditional remedies lock in the heat. And that will actually make the burn penetrate deeper. So please
Oh,
do not try any of those remedies. If you are somebody
तो
who
ये फिर से
has,
सुनिएगा. दिस इज अ वेरी इंपॉर्टेंट पॉइंट. व्हाई यू शुड नॉट. किसी ने आपको ये बताया नहीं होगा कि ये क्यों नहीं चलेगा. आई थिंक डॉक्टर सृष्टि, लेट्स रिपीट दिस एज मच एज पॉसिबल. सो
yes.
जब भी बर्न होता है,
So
इमीडिएटली घर के नुस्खे मत यूज कीजिएगा, क्योंकि मैम प्लीज कंटिन्यू.
बिकॉज आपके घर के नुस्खे में आप जब घी, ऑयल या नारियल का तेल, आटा जो भी डालते हो, या टूथपेस्ट लगाते हो, या टैल्कम पाउडर डालते हो, इससे आपका हीट लॉक हो जाता है, और जो बर्न की जो गर्मी है वो और स्किन के अंदर जाती है, आपका बर्न का एरिया बड़ा हो जाएगा. वेरेज हम नॉर्मली, अगर कोई भी हमारे पास बर्न्स के साथ आता है, तो हम बोलते हैं उस एरिया को एक्सपोज करके रखो, वो हीट को के शरीर से. So please don't use any home remedies so that you don't lock in the heat. Always keep silver sulfadiazine cream with you at home. अगर छोटा सा burn हो, then just run it in cool water and apply that cream and leave it. But if the burn surface looks larger, if it is any child, especially, less than 12 years of age, if it is a pregnant person or an elderly who has burns, or if there is any burn over the face area, your hair has any, singeing, or after a burn you cough and there is even a little bit of blackish material that comes, please don't think this is pollution, I don't have to worry about it. It is not. Please go to a healthcare professional.
Wonderful, ma'am. So, while we talk about burns, let's also talk about the candle wax burns. These are not direct burns,
Yes.
but then what happens when there is a excessively hot molten wax which is solidified on your hand? Can we treat it as a burn?
So these are called scald injuries, and this doesn't have to only be candle wax. It could be hot oil, somebody cooking, you lose the kadhai loses balance, you have hot oil over yourself. Diya ka oil may spill over you.
Oil.
It could be candle wax. Now, unfortunately, these burns are as bad as a direct burn. In fact, these are they spread over a surface very quickly. So, for example, if it is a matchstick or an explosive that has fallen on your hand, it will be limited to that area. Whereas if it is an oil or a wax, it will quickly spread over the surface. And actually, these burns are as harmful. They also tend to spread deeper faster. So follow the same precautions. No ice, just run in cool water, apply silver sulfadiazine, no home remedies, and go to a doctor if it is a large area, more than the size of your, or even the size of your palm and above, immediately go to a healthcare specialist. If in case it's a child, then irrespective of the size, please go to a healthcare specialist.
Yes, ma'am. Thank you. So the silver can you please repeat that again?
Sulfadiazine, silver
Sulfur.
sulfadiazine.
Right. So you find them over the counter, or do we require
Over the
a
counter,
prescription?
yes. No, no, you don't need a prescription for it.
Great. So we will put it up the link to Apollo 24/7 pharmacy where you can order it and keep it ready for you just in case. It's always good to have first aid handy in your home.
Always,
But,
yes.
yeah. So before I come back to the first aid, one quick thing: what is a first degree and a second degree? What's the difference between the burns?
So essentially, the degree of burns is related to the depth of a burn in your skin. So often we would associate it with how extensive the burn is, but by extensivity here we're talking about the depth. So a burn that's only on the skin surface is a first degree burn. A burn that involves the underlying tissue, fat is a second degree, and the one which goes further down up to your muscle tissue is a third degree burn. So it's very unlikely that you're going to be, as a non-healthcare trained professional, it's very unlikely that visually you will be able to tell what degree of a burn it is. But the usual rule of thumb is any burn more than the size of your palm is a significant burn.
Okay.
And
So
the
while we
size of
talk
the
about
palm of the person burnt,
Acha, not
not
yeah,
the
not me,
adult.
not
Yes.
yeah, not the adult, right? So yes, next question is Vivek Sharma ji's question. If it is an electricity burn, what is the first thing that we should do?
Um, So electricity burns are always a little worrying. If it is a short shock, which is, say, sometimes it's just an earthing issue, then, and if you've not had any feeling of the shock going past your body, if you've had no discomfort, if you don't have giddiness or any of those, then it is okay. But any other burn requires you to go to a hospital immediately. And the reason is whenever there's an electricity burn, there is both a point of entry and a point of exit. Many a times we ignore that. We don't realize that there has been a point of exit. The burn, the shock goes through the body and it can cause a lot of damage through all the organs that it passes. And this is something that, we will not be able to visually see from the outside. Similarly,
Yeah.
any burn or any injury that has caused even a transient of consciousness, please don't neglect them. Don't assume that, it's pain shock. Until and unless you have confirmed with a healthcare professional that it is not worrying, I would say please get healthcare help because a lot of times, like I said, when a burn passes through your body, we don't realize externally, but it can cause a brief, loss of consciousness or it can cause the person to fall. It can cause an injury otherwise because of the fall. So electrical burns are always a concern. Please seek healthcare.
वेरी वेरी इंटरेस्टिंग ऑब्जर्वेशन मैम, थैंक यू सो मच। बिकॉज आजकल दिवाली में हम लोग इतना सारा लाइटिंग इलेक्ट्रिसिटी
Exactly.
यूज करके करते हैं। दिस इज ऑल्सो समथिंग दैट वी ऑल नीड टू बी कॉशियस। थैंक्स विवेक जी फॉर आस्किंग दैट क्वेश्चन। नेक्स्ट क्वेश्चन इज मेघा। Megha is asking about a patient who got their transplantation done 8 months earlier. So, what can we do in a high pollution environment and especially the festivities for the safety of such patient?
Hi, Miss Megha. I'm sorry, I don't really know what organ transplant you're speaking about here, but the general rule of thumb would be for anybody who has undergone any major surgery. It could be a transplant, it could even be a bypass surgery, or any major surgery of the abdomen, brain,
And
anywhere.
also,
The first
also the age.
year, yeah.
If Megha, can you please type what age and which surgery? In the meanwhile, ma'am is going to talk about it. Huh? Yes, ma'am. Please continue.
Anybody who has required any of such intense healthcare, the first year is very crucial. So try and keep them inside a safe area. You define a safe area in your house. It could be a room, it could be an area of a room, or wherever it is. And that safe zone should only be limited to the number of people who visit. Nobody who has any infection, cough, cold, fever should visit the area where the transplant patient is. The third is try and, again, like I said, don't excessively deprive them, but be very careful with the kind of food they eat. Avoid outside food. If they really want to have something, try and give them something home cooked. Limit the number of visitors. If you have guests over for Diwali, always make sure they're wearing a mask when there are visitors around. Ensure that if they want to open their windows, it's not during dawn and dusk, and when they do, that they wear a mask on them. Watch for the
Yes.
smallest sign and symptom of any kind of um discomfort. If they look like they're sleeping excessively, please don't assume that they are just tired. If anything seems off from their schedule, always consult healthcare.
Thank you for that comprehensive answer. I was waiting for Megha to respond, but I didn't find the response there. But that's okay. We'll continue. And
Yeah.
last two questions. How long do burns take to heal? The simple burns take to heal, and what's the process of taking care of it?
So, the usual time that a burn would take to heal would be anywhere between 10 to 14 days. You don't really need to do anything about it. If you've looked up, if it's a small, simple first degree small burn, and if you've just treated it with cool water and silver sulfadiazine, then in a couple of days it would usually form a scab. And my big recommendation is even if it blisters, please don't try and pick the blister. Please don't try and burst it or pick it. There is a lot of traditional belief system where they say that you heat a needle and you prick it and the water comes out. Please don't do any of that. All the scab and blistering on your skin is your body's way of creating a protective shield around the burned skin till it forms a new skin. Let your body do the work. Give it time. Don't cover it. No band-aids. No locking in warmth over there. Just be careful. And if at any point it becomes painful, the area around it becomes red, or there is anything yellowish green in that area, you need to go to a doctor.
Well, thank you so much, ma'am. I think, yes, with this, I will ask you for top tips from your end to take care and celebrate a happy Diwali.
So, thank you so much. It's been a pleasure answering all your questions. And my first top tip is enjoy Diwali. It comes once a year and it's our festival of lights. But while doing so, number one, please make sure you avoid excessively processed and canned foods. Limit yourself to one sweet a day. Make sure you're well hydrated. Have about 8 to 11 glasses of water every day. Ensure that if you are an asthmatic, you don't skip your inhalers and you have an emergency inhaler by your side at all times. Wear a mask when you're in public or when you're exposed to firecrackers. Please do not use sanitizers before you handle anything that can, cause fire. Treat every cracker like an explosive. Enjoy it, but make sure you maintain your precautions. And have a
Thank
happy
you.
and safe Diwali.
Thank you, Dr. Srishti. It was wonderful talking to
Thank
you.
you.
I have had such a wonderful time with you, speaking to you and getting knowledge. And I have a lot of tips and take home messages from your session this year. I think, first and foremost, do not overeat. Have only one
Yes.
piece of sweet. I can see sweets lying all over my counter from here. So I will make sure that I am counting what I am sending in, and also drink water each time that you come out of a restroom, and make sure
Correct.
that I am drinking enough water. So wonderful tips from
Yes.
you, Dr. Srishti. It was amazing having you on the show.
Thank you.
Thank you so much.
Thank you. Thank you so much.
Thank you. Well, that was Dr. Srishti Patodia giving us tips and Diwali safety guide. Now it's your chance of answering questions. I'm going to ask you three questions in the health quiz. This is a quiz where you can participate. If you want to participate, hop onto YouTube chat box and type your answers there, not on the Instagram or Facebook pages, but only on Instagram. So you have to answer the questions on YouTube chat. Winner's name will be announced towards the end of the show, and they'll be selected by the sole discretion of Apollo 24/7 team. If I take your name to be the winner, winners need to email their contact details at marketing@apollo247.com, and gift vouchers will be shared with you. Just for the discretion of the viewers, let me also announce that the winners selected will need to provide a phone number in which they have Apollo 24/7, and that phone number should be exclusively used for this week's health quiz. You know, a lot of, we see that there are very regular participants of the health quiz, but yes, we do have a policy of letting everybody win. Hope you understand. So happy quizzing. Here are the three questions for today. The first question for today is fill in the blanks. D से शुरू होता है, S से end होता है, D blank A blank ETES is not caused just by eating too much sugar. What is it? Fill in the blanks and create that word. Question number two: air pollutants can irritate your airways and may cause shortness of breath. Yes or no? Air pollutants can irritate your airways and may cause shortness of breath. Question number three: true or false? A burn can occur when heat, chemicals, sunlight, electricity, or radiation damages the skin tissue. True or false? So these are the questions for today. Three questions. Keep your answers coming in. I see a lot of participants who are regulars and also new participants typing. Wow, what lovely participation today! And I didn't see all of you in the questions today, but wonderful. Please let me give you the quiz coupons, the gift coupons. The first one that we are giving away today is consult Tom Doctors direct from Apollo by using the code ASKDOC150. Ask Doc 150, get 150 rupees cash back on online doctor consultation. And also, this is the next coupon that we're giving. For the 25% off on online medicine orders, use code FIRST3, 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 and you get 25% off on online medicine orders, first three orders above 1000 rupees, and you also get to our delivery window if you order from Apollo 24/7. Also, for our Health Hub viewers, we give away this coupon. Use the code HH247, get 199 off on online doctor consultation and up to 20% off on medicine orders. This is in addition to the other coupons that we've given away. Well, let's see who the winners are. In the meanwhile, let me tell you that Apollo 24/7 now can be accessed on WhatsApp as well. You can call or text on 9355 247 247. Save this number. You can avail healthcare services just like you do from your Apollo 24/7 app. So next week we are having a holiday because it is Diwali. We all want to enjoy Diwali. Safe Diwali to you all as well. आज हमने बात किया है Diwali safety guide के बारे में. So make sure keep all these tips Dr. Srishti has shared in your mind and have a great Diwali. And the winners for today are Satnam Singh, Vivek Sharma and Harminder Kaur. I repeat, Satnam Singh, Vivek Sharma and Harminder Kaur. Congratulations, winners. And you have to write back to us at marketing at apollo247.com with all your details so that we can share the gift vouchers and the prizes with you. Thank you all. Reminding you again, please do join us on the 19th of November, 11 a.m. We shall announce the topic and the expert very soon. Till then, have a great Diwali, manage yourself, and keep everybody around you safe. Namaskar. Thank you for joining us.